The government didn't shut down because of money. It shut down because of power. Because the people who profit from keeping others sick finally found a way to sell cruelty as fiscal discipline. And they call it a fight over spending, but this isn't about budgets. It's about belief. It's about whether healthcare remains a public trust or goes back to being a private business where the value of a human life depends on what's left in their checking account. Republican lawmakers say that Democrats have shut down the government to give free health care to illegal immigrants. That's their rallying cry, anyway. But it's built on a lie that's so thin you can see the greed shining through it. The only law that remotely touches that issue is EMTALA, a Reagan-era statute from 1986. It says that hospitals that receive Medicare funds must stabilize anyone who walks into an ER in critical condition, regardless of citizenship or insurance status. It's not free healthcare, it's triage. It's a law designed to keep people from dying in the waiting room, a law that can't be changed in a budget bill. Because appropriations bills fund programs that already exist. They do not write or repeal laws. That power belongs to separate authorization legislation, which must pass both chambers through normal order. The only time Congress can alter a standing law inside a budget bill is under reconciliation, a tool created in 1974 to allow narrow budget-related adjustments to taxes and spending. But even then, the Byrd Rule prevents adding anything that doesn't directly affect the federal budget. So you can adjust subsidy amounts or spending levels, but you can't rewrite legal eligibility requirements like the ones laid out in EMTALA or the Affordable Care Act. So when Republicans say this shutdown is about Democrats wanting to fund free health care for undocumented immigrants, they're doing something far more sinister than lying about numbers. They're lying about the process itself. They're pretending a budget resolution can fix a legal issue it doesn't even touch. They're counting on the public not knowing the difference between a law and a ledger. But the truth is this. There's nothing in the One Big Beautiful Bill Act or the continuing resolution that deals with immigration or health care for undocumented people. Nothing. What those bills do contain are deep cuts and structural changes to health care programs for everyone else, ordinary Americans. The OBA phases out ACA premium subsidies. It slashes Medicaid funding and defunds key health care provisions under the guise of balancing the budget. And that's what this shutdown is protecting. The right to make illness profitable again. The ACA didn't socialize medicine, it civilized it. It said every insurance plan in America had to cover real human needs. Hospital care, maternity, mental health, preventative screenings, prescriptions. It banned the practice of denying coverage for pre-existing conditions. It said that your plan couldn't run out just because you got too sick or too expensive. It required insurers to spend at least 80% of every premium dollar on actual care, not marketing and profit. It fined hospitals that kept readmitting patients without improving outcomes. It forced transparency, and that's why they hate it. Because it turned health care from a roulette wheel into a moral obligation. And before the ACA, millions of people had just trash insurance. Cheap plans that vanished the moment you actually needed it. They didn't cover maternity care, mental health, or prescriptions. They covered hope and very little else. The ACA made that illegal. It said that if you live in this country, you deserve coverage that works when you're sick, not just when you're lucky. And that change came at a cost. People who had been buying cut-rate plans suddenly had to buy real insurance, which did mean higher premiums for some of them. But that wasn't failure. That was fairness. That was how you build a functioning risk pool, by making sure the healthy and the sick share the same roof. And insurance only works when we all carry it together. And while that raised costs for a few, it lowered costs for millions more. In fact, 80% of those using ACA exchanges now receive subsidies that keep coverage affordable. The law turned health insurance into something closer to a shared civic responsibility. And the Republican Party has never forgiven that. Because at its heart, the ACA declared health care a right instead of a commodity. It said profit had limits when measured against human suffering. And for an ideology built on the mythology of markets, that was downright heresy. They can't sell the truth, because the truth is that they want to privatize and monetize your access to care. So they sell fear instead. Fear of immigrants, fear of deficits, fear of anything that sounds compassionate. They turned the word government into an insult, the word profit into gospel. And they do claim that Democrats were offered a clean budget resolution. Clean as if they were a matter of hygiene rather than deceit. But hidden inside that so-called clean CR were the riders, the rollbacks to ACA subsidies, new Medicaid work requirements, delays in Medicare Advantage reforms. It's not a clean bill. It's a quiet coup. And Democrats didn't reject it out of stubbornness. They rejected it because it would have gutted the ACA from within, just using the budget process as a scalpel. And they had to hold the line now, not later, because the timing matters. Open enrollment for 2026 begins November 1st. Insurers are setting their rates right now. And if Congress doesn't clarify whether ACA subsidies will continue, insurers will assume they won't, and they'll raise premiums dramatically. And once those rates are locked in, even a future deal won't undo them. That's why Democrats can't simply negotiate later. Later is too late. The market will have already priced in the uncertainty that Republicans created when they allowed the OBA to phase out the subsidies without renewal. And yes, Republicans knew this would happen. They knew it when they voted on the OBA. They saw the Congressional Budget Office projections showing that letting those subsidies expire would drive up premiums by as much as 75% and cause millions to lose coverage. They read the actuarial filings from insurers. They were warned by state regulators, but they didn't give a shit because the plan all along was to blame Democrats for the fallout. That's their quiet strategy. So when premiums spike next year, they'll say, see, the Democrats caused this by refusing to reopen the government. They'll claim that if Democrats had just agreed to their terms, markets would have stabilized. They'll say cooperation would have sent a reassuring message to insurers. But insurers don't price based on feelings. They price based on the law. And the law Republicans passed removed the certainty that kept premiums stable. The blame was scripted in advance. They created this crisis, and now they'll sell the consequences as someone else's fault. Men acting in bad faith will act in bad faith. That's not cynicism, it's arithmetic. And if this were truly about enforcing the law, Republicans could propose a standalone bill to address it, but that would require a real debate, one that exposed the falsehood at the center of their argument. It's easier to hide behind a shutdown and pretend that a budget can fix what legislation already forbids, because that's not governance. That's fraud. The truth is, shutting down has nothing to do with immigration or law enforcement. It's about power and profit. It's about erasing a decade of progress in making health care accessible and doing it under the false banner of fiscal responsibility. And the ACA isn't perfect, and we should acknowledge its shortcomings, the coverage gaps, the paperwork, the bureaucratic frustrations that remain. But imperfection isn't failure. The ACA expanded Medicaid. It lowered uninsured rates to historic lows, and it gave millions a measure of security they'd never known before. Republican lawmakers have spent the better part of a dozen years promising to dismantle it and replace it with something better. They've said again and again that they have a plan, but that plan has never seen daylight, and it doesn't exist. They don't want a plan. They want privatized insurance markets with skyrocketing profits, quarterly earnings calls that celebrate record premiums, and shareholder meetings filled with cigars, scotch, and blind eyes to suffering. Their idea of reform is a waiting room you can't even afford to enter. The real cost of this shutdown isn't measured in GDP or lost paychecks. It will show up in families who lose their coverage, in children whose checkups are canceled, in senior citizens who ration medicine again. The numbers will fade from the headlines, but the damage will live in flesh and bones for a generation. A government that can fund endless war but not care about the wellness is not defending freedom, it's selling it. The Affordable Care Act was an imperfect promise, but it was a promise kept, and right now it's being held hostage by men who confuse cruelty for strength. But laws aren't cages, they're shields. They protect the living from those who mistake profit for providence. So yes, Democrats must hold the line. Not because it's politically convenient, but because surrender now would mean surrendering the very idea that the health of our people is worth protecting. And if the lights go out for a while, fuck it. So be it. The truth shines brightest in the dark anyway. Defiance till death.